meeting with me. I have some questions about health.
I think I'm healthy.
Healthy?
Healthy.
Healthy.
Healthy. I consider myself pretty healthy.
Pretty healthy.
Healthy.
Relatively healthy.
Healthy body, healthy mind.
You know, I'm healthy. I'm healthy.
Even though you think you're healthy, you can be healthier. You know, have you pay attention is your posture, because you need to sit up straight. So let me just see how tight your neck muscles are, how painful this is. And so is this one.
Yeah.
It's scapula, the wing. See, when I touch those areas, those are acupuncture points too. It also tells me something about how much stress you have, how your mind is actually having a lot of issues. And
Great.
I exercise 3 to 4 days a week.
Exercise as much as I can.
Every day for about 30 minutes.
Do yoga every day. I go to the gym 4 or 5 times a week.
I do aerial silk and I weightlift.
I keep asking people, what type of exercise do you do?
Right.
Because some people do the wrong exercise. So a lot of people basically need to have someone to teach you to have the right kind of exercise. Okay, let me take a look at your tongue today. So look at your tongue. But I want you to know that the tongue can tell us a lot about your overall health.
The tongue.
The tongue
Okay.
is an internal organ that you can actually look at very easily.
I don't want any red color or pale color first, the color, and then the shape of it can't have scallop marks on the side. If you're like very super wet, we also don't want that. Okay? So we want to make sure that the perfect tongue will be a nice pink color. Don't even have strawberry marks on it, like little dots. We don't want any dots on it. Those are the ones we're looking at. Like a nice pink tongue.
Based on the results of your tongue diagnosis, either stay put or take a step back.
Well, the tongue was definitely a big one. I look at my tongue in the mirror and I'll like do the back of my toothbrush and like scrape it off, but I never realized that there's more to it than just like having gunk on there.
I've become incredibly self-conscious of my tongue, something I wasn't aware that needed improvement.
I learned that I have a narrow tongue and it's also red, which means I'm very tight and anxious, which is definitely true. I get very stressed out very easily and I didn't realize you could see it in your tongue.
Do you have a tight neck? If so, take a step back.
The neck connects the head with the brain to the rest of the body, and the nerve that control the eyes, the nose, the jaw, the tongue, and the stomach and the heart, they're all around this part of the body. So oftentimes it's very important to feel how tight your muscles are and how flexible, or inflexible you are, as a way to test how healthy you are.
Do you have frequent back pain? If yes, take a step back.
Most people would have tightness in their back. They may feel uncomfortable. And oftentimes it may be stress related, both psychological and mechanical, but it also relates to your health in your internal organs. So very important for us to pay attention to our posture, because if the posture is no good, both the neck and the back are in trouble.
This is only for females. Do you experience menstrual pain each month? If yes, take a step back.
A lot of women come to us with the idea that, well, I have menstrual cramps, I take a little NSAID, like ibuprofen, they already get it taken care of. So when you take pills to suppress the symptoms, which is fine, but it is indicative that your body physiological systems that control your nerves, control your hormonal system is off. And it's very important for this to be addressed at the root, so that later on in life, when you get pregnant or when you go through a perimenopause, during those specific periods of one's life, so it's not just a little pain when you take a pain pill to suppress it.
Do you have unresolved childhood trauma? If yes, take a step back.
I have always looked into the patient's childhood experiences. So it's very important for us to optimize the environment for the child, before he's born and after he's born. We have seen patients who come in with series of health problems, but sometimes it may be traced back to when they were in boarding school, they get bullied, or they were brought up in a family, there's a lot of family dynamic issues. So basically, don't ignore many of these sort of problems. It needs to be addressed at the root and as early as possible.
So what do you like recommend for, you know, someone like me to do on a daily basis?
So what we want to emphasize, Western medicine is very good in acute crisis management, even detection, stabilization, but other health traditions can be used to help you maintain health and actually improve your health.
Right.
By some of the things like Tai Chi, self-massage, meditation. So that's what I would like you to pay attention.
Concludes it. If you guys want to just kind of take a step and look at where you are and think about how far away you are from healthy.
For more information about the topics we discussed in this video and new video updates, please check out our website and subscribe.